Good to see you, and very
you.
good to be back.
Particularly good to see you because you've been off for a couple of weeks.
I have indeed.
Under the surgeon's knife.
I have. Well, kinda, because it was keyhole.
Yes.
Keyhole surgery
Yes.
is astonishing, isn't it?
Fantastic. Well, you and I have broken quite a few taboos talking about health over the years. Do you remember you talked about the menopause very openly?
I did. And we couldn't get anybody to talk about it.
And you did.
So you ended up interviewing me.
And we swapped places, and we're going to swap it now.
Oh, OK.
Yeah, we're going to swap places right now.
OK.
Because I want to know all about your operation.
Oh, my goodness me.
Because
Am I being interviewed?
You're going to be interviewed, yes. So tell me, what operation did you have?
Well, it was keyhole surgery to get rid of my ovaries and fallopian tubes.
Right.
Keyhole is amazing. I've got 3 new holes in my body.
OK.
Fantastic.
OK.
All healing beautifully.
So very uninvasive, really.
Yeah, really incredible. Absolutely incredible. I was looked after so well. The team were great. There's Mr. Rafa, who did the surgery with Billy.
Lovely.
That's the only thing. I'm not allowed to lift Billy
Not yet.
for another couple of weeks.
Yes.
Yeah, Mr. Rafa was holding Billy, and I said, when can I lift her up? And Billy is a substantial child. You know, she is. She's proper.
Right.
And he said, oh, I'd give it till the end of the month
Yeah,
for that.
a little bit
But yeah, it
longer.
was great. What happened was, do you remember I told you back in January I was coming back from India, and on the flight I had terrible pain, and it was a cyst that had burst, an ovarian cyst that had burst, and you know, there was a bit of bleeding, and when I say discomfort, you know, I'm stoic,
You were very
but
uncomfortable.
jeez, it was horrible. So I went to see Mr. Rafa. We had a scan and did all of that, and he said on the other side there's an ovary that looks a bit dodgy.
Right.
Best to just take it out.
OK.
Best to just get rid of it.
So ovarian cysts, and there are various types of ovarian cysts. They're the functional ones that you get before the menopause.
Sure.
When you release the egg, sometimes that follicle can get filled with fluid. It refills with fluid. But after the menopause, those cysts can, usually they're benign. We call them cystadenomas.
Right.
So cysts arising from ovarian tissue, which can again become quite large, full of fluid or mucoid
some of them
material.
are huge.
Yeah,
huh?
absolutely. But although they're usually benign, they do have the potential to turn malignant. So as a precautionary measure, sometimes it's useful to just remove the ovaries and the fallopian tubes as
Peace
well.
of mind, isn't
through
it?
laparoscopic surgery. So keyhole surgery, as you say.
It's incredible.
You had a general anaesthetic?
Yep.
Yeah, how
All
was
good.
that?
Absolutely fine. I mean, I've had it before, and I was fine. Only stayed in for one night.
Oh, wow.
But so well looked after. Everybody at Heatherwood. It was just, yeah, I couldn't have asked for better care. You know, really.
That's
and then
good.
obviously when I went home, Steve had to do everything.
Of
So
course.
I'm not even
and
allowed.
he will have to do all the housework for the next 3 months or so.
I'm not allowed. I'm not allowed to hoover. apparently.
No,
Not allowed
washing
to
up.
lift anything.
Just lifting Billy.
But you know, there's the best medicine.
Yeah. There you
In
go.
the world.
Right
That is
there.
the best medicine. Even though I can't lift her, I can cuddle her. And, you know, that just raises the spirits. Because, you know, after surgery, I think you do need... Because it can affect you in so many ways.
Of course.
It's a bit emotional and
I wanted
everything.
to ask you about that because many women going through either a hysterectomy or removal of the ovaries may feel an emotional impact. They think, oh, am I less of a woman? Is this going to affect me in any other way? Did you have any thoughts
Not really.
like that?
I think because of my age, you know, I'm nearly 66.
No,
and
can't
sadly
be.
and tragically... I
Makeup,
can't...
very good.
She's Helen, so Helen. Obviously, that ship has sailed a long time ago, having babies. But no, the only thing is, Mr. Raffat said I might have to take, I'll have to take tiny amounts of testosterone, very controlled.
Yes.
You know, I'm not going to grow a beard and be smoking like that.
No.
It'll be fine, but you just have to do, you know, there's things just to get the balance right.
Because what I think a lot of women don't understand is that you make estrogen and testosterone, so a little bit of testosterone, not like a man making that much quantity of testosterone. But that testosterone is an essential part of, you know, giving you energy, giving you a desire, sexual desire. It's quite important. So a little bit of that, not a bad thing at all.
Sure.
But the fact that the ovaries have been removed doesn't bother
No,
you.
it's relief, really, because, I mean, pathology came back, everything is fine, everything is OK, nothing sinister at all, and that's very reassuring. But, like, as you say, it's just, you know, it's preventative, and it means it's one less worry. So for me, it was actually an amazing thing to do and the right thing to do. And, you know, I would just say to MD, if you're worried, you know, I mean, make sure that you go and get yourself checked out.
Yeah. Well, you're very clued up, of course. You know,
well,
you know what was expected. Heatherwood Hospital did a fantastic job. And here you are, a couple of weeks later, you know, and back to the normal job. So it sounds like you've sailed through this.
Yeah, very much so.
A bit tired?
Yeah, I do get really tired. I get tired and I have to watch because, you know, normally I'm running around like a blue arse fly, as they say. It's a medical term, as you know, Dr Hilary. But yeah, you have to just kind of take it a little bit easier. But I'm really glad to be back because I missed you all so much.
Oh, we missed you.
You know,
very much
I
so.
really do. I missed you all so much. But like I say, I'm totally fine.
Yeah.
Everything's fine. Like I say, everything came back and it was all right. But it's preventative.
And what it proves is it's nothing to be frightened of.
No,
you know? And
no.
these days, general anaesthetics are so good these days. You probably woke up within minutes.
Well, I woke up and I went, oh, right. When's it happening then? What's going on? When's it happening?
Yeah.
And it's just, you know, it's uncomfortable a little bit. You've just got to take it easy.
Sure.
But I'm so lucky that everybody, you know, like Steve looked after me, Rosie looked after me, and like I say, Billy, the best medicine in the world.
Absolutely, absolutely.
That lifts your spirits.
Well, we're thrilled to have you back, and you look absolutely marvellous.
Look at that baby, isn't she great? She's gorgeous.
Super.
Gorgeous, gorgeous, gorgeous.
Super.
Now, look, in other news, Joe Biden, that was a shock, wasn't it?
Yeah.
I mean, I know he's 80 odds, but that's still a shock.
Now, 1 in 8 men will get prostate cancer in their lifetime, 1 in 4 in black men. So this is common, and age is a factor. Age is a factor. So the older you get, most men of his age will have some degree of prostate cancer. Right. But his has been diagnosed. He was having more symptoms, so he got it checked out, and he's got a Gleason score of 9. What that means, it goes up to 10, 1 to 10. So Gleason score means that the cells that they found are very aggressive. They don't look like prostate cancer cells. So what we call anaplastic cells have a potential to spread very quickly. So he's got options. It's hormone dependent, so they can block his testosterone levels in certain ways. They can give him radiotherapy, surgery if it hasn't spread too far. If it's already spread, too late for surgery. But he's got options. Right. And of course, we had Chris Hoy on, you know, on your show not so long ago.
He has done the best job. They talk about the Chris Hoy effect, but it just shows you that it can affect much younger men.
It can.
As well.
It can.
And you have to, again, it's like be aware of any symptoms.
Any man who's got a weaker stream of urine, who's got urgency that have to go right there and then, who've got hesitancy starting or, you know, dribbling at the end, they should go and get it checked out, not to be scared, especially if they're black, especially if they've got a family history. But even men under 50, you know, and anyone can go and see the doctor and say, I would like a PSA test done, a prostate-specific antigen blood test, you know, if there's reasons for it. Don't be scared of doing it either.
No, absolutely, can save your life, for goodness sake. Absolutely. We're so silly, aren't we?
We shouldn't be frightened, as you've proved.
No,
you know,
don't be daft. To just
get that operation
and then you get the reassurance that everything's okay, which is what I've got, which is fantastic. Hills, thanks.
No, thank
Great
you,
to see you.
welcome
thank you
back,
so
and
much.
stay well.
Lovely to be back. Well, that's a wrap for this video. We hope you enjoyed it. We have all the best moments from the show right here on the channel, and if you like this video, then we think you'll love this one. See you next time.